All right, so I'd like to welcome Cassandra. Thank you so much for coming today and speaking to us. Cassandra's a licensed professional counselor who earned a master's degree in clinical mental health counseling at the University of Bridgeport and a bachelor's degree in psychology from Sacred Heart. So nice and local.
Yes.
Cassandra has a range of experience in outpatient settings, working with adults, adolescents, LGBTQIA, and community, as well as families and couples. Cassandra is recently trained in EMDR. I'm interested in hearing. For Cassandra, the therapeutic relationship is the most essential part of the healing process for her clients. She creates an environment that is safe and welcoming by using a humanistic approach. Cassandra has experience working with anxiety, depression, personality disorders, perinatal and postpartum care, mood disorders, trauma, PTSD, and relationship issues. Her experience encompasses a wide range of therapeutic modalities: cognitive behavioral therapy, solution-focused therapy, dialectical behavior therapy, and motivational interviewing and EMDR. Cassandra is board certified by the National Board of Certified Counselors and is a member of the American Counseling Association. Embracing change. Favorite, is this the rest of it?
I think more of that.
Yeah, I think that matched with it, but Cassandra came to talk to us today about mental health and kind of how things are adapting and are changing laws and everything. So,
Well, thank you. I appreciate that introduction. It sounds like I have a lot of credentials, but I'm just a clinician doing some good work. I am the owner and founder of MJ Behavioral Health and Wellness. We are actually located in Corporate 2. We're opening another location in Fairfield. So thank you guys so much for the opportunity to be here today and have the option to speak with you. My first experience with mental health happened when I was about 18 years old, just starting out as a freshman in college. I didn't know where to begin or how to ask for help. I was overwhelmed and unsure of what steps to take. It was my mother who made the call to the University Counseling Center. That simple act became the starting point of a journey I never expected to be on, but one that has shaped the rest of my life. Looking back, so much has changed. There is more conversation around mental health, less stigma, and a greater sense of openness than when I was a student. But one thing that still has not changed is enough access. Too many people, especially those who need it most, still cannot get the care that they deserve because it remains unaffordable or out of reach. According to the American Foundation of Suicide Prevention, suicide is the 11th leading cause of death in the United States. In 2023 alone, almost 50,000 Americans died by suicide, and they were an estimated 1.5 million suicide attempts. These numbers are more than just statistics. They are a reflection of a mental health system that continues to fall short for far too many. Access to mental health care remains out of reach for a large portion of the US population. Even those with insurance often face significant barriers, including a shortage of providers who accept insurance, limited coverage, high out-of-pocket costs, and fragmented or inconsistent care. These obstacles contribute to a growing crisis in which individuals with treatable mental health conditions are left without the support and services that they need. I entered the mental health field in a pre-COVID world, and since the pandemic, we've seen an exponential rise in mental health concerns, especially amongst our most vulnerable populations, children, adolescents, and the elderly, which it seems like many of you work with. Unfortunately, access to affordable care hasn't kept pace with the growing need. At MJA, I regularly hear from parents and caregivers who are struggling to find providers without long wait lists, who accept insurance, and who offer in-person appointments for clients. Even when providers are geographically accessible, families and individuals with insurance often face another barrier. Many of us are out of network. That leaves people either paying high out-of-pocket costs or in many cases not seeking care at all. In addition to systemic insurance barriers, unsupportive workplace cultures often discourage employees from seeking help. Fear of stigma, concerns about confidentiality, and a lack of mental health accommodations can prevent individuals from accessing services even when they are available. I'm sure many of you guys offer EAPs and things like that. The absence of mental health friendly policies in many organizations further exacerbates the issue, particularly for working adults juggling high stress jobs and family responsibilities. According to the Association of the American Medical Colleges, the Mental Health Parity and Addiction Equity Act of 2008 mandates equal coverage and benefits for mental health and general medical conditions. Gaps between insurance coverage for mental health conditions and other medical conditions still exist and continue growing, not to mention the insurance practices that are most likely to impede access to mental health care, including ever-changing medical necessity standards, and network inadequacy remains pervasive among all insurance companies. One of the biggest issues I see within the mental health profession is more and more providers are leaving insurance companies due to low reimbursement. It's important to note that the criteria for how insurance companies define quote unquote medical necessity of mental health services are inconsistent, which results in high rates of claim denials. Combine this with low reimbursements, mental health professionals are de-incentivized from joining and or remaining in insurance networks, leaving more and more people without appropriate care. Insurance companies often employ a fail-first approach to mental health treatment. What that means is it requires patients to try and fail at lower cost interventions before approving more comprehensive care. This practice frequently delays access to appropriate treatment, forcing individuals to wait until their condition worsens before receiving the level of care they truly need. For those experiencing severe or escalating symptoms, such delays can be harmful and in some cases life-threatening. These cost containment strategies ultimately hinder timely, effective intervention and can significantly worsen outcomes for high-risk individuals. With a growing share of the population reporting mental health and substance use issues, policymakers need to prioritize expanding access, coverage, and affordability of care. Both state and national policies need to be reformed to captivate insurance companies enough to reduce stringencies on medical necessity determinations to enhance access and coverage. However, policies expanding medical necessity determinations must be enacted together with policies addressing network inadequacy and the provider reimbursements, because focusing solely on medical necessity can only help so much if providers do not take insurance. Since the pandemic, telehealth capabilities have helped broaden the availability of mental health services to those most marginalized populations, such as those in remote locations and the elderly, providing the opportunity to offer clients with limited resources the ability to access providers via telemental health platforms has offered individuals who otherwise may not have access the ability to see a provider. At MJ, our mission is to do our part to combat some of the disparities our clients face to ensure they have access to affordable mental health services. We provide a collaborative approach to care and offer an inclusive environment. We take pride in treating the holistic needs of our clients by offering a wide array of services. At MJ, we remove the barriers from clients to have access to mental health services by ensuring we provide a one-stop shop for all their mental health needs. We offer talk therapy, medication management, which remains in line with traditional mental health services, and we have begun offering acupuncture, Reiki, and trauma-informed massage to ensure we also offer holistic services to treat the entire person. We don't turn anyone away from receiving the care they need, regardless of their insurance or ability to pay for services. And while our contribution may be just one piece of the larger puzzle, we will continue to advocate for reform and equitable access to care. The mental health crisis in this country demands more than conversation, it demands action. It calls on policymakers, providers, insurance companies, and workplaces alike to do better, to work together, and to build a system that truly supports those who need it the most. The slide here highlights several advocacy organizations in Connecticut that are doing critical work to improve mental health care across all age groups. They're leading efforts in policy change, insurance coverage, peer support, and professional development. Whether it's supporting families, pushing for parity in insurance, or promoting trauma-informed care, each group plays an important role. I encourage you to explore their work and consider how you might support or collaborate with them in improving access to mental health care as everybody is needing it today. Thank you so much for allowing me the opportunity to come and speak to you guys today. I'm very passionate about the work we do at MJA, and open up the floor, I believe, to questions or any comments.
I'll have a question in terms of funding.
Sure.
You know, no one gets turned away, which is admirable.
Thanks.
And how do you manage that in terms of just from a business perspective? I mean, do you have any support from the state, or is there any, or individual fundraising of yourself? How does that all work?
So we are a for-profit business, so we do not qualify for any, sort of funding or fundraisers.
Right.
We do it very carefully. I say that lightly, but it's really a case-by-case basis. We do have interns, which allow us the opportunity to provide services at no cost or reduced cost. So that is something that we have developed within our organization. As many of you know, interns are in their master's program and they are finishing their hours with us. So that allows us to provide that affordable care. We offer financial assistance, we offer payment plan options, but we've never turned anybody away. As long as it makes sense from a fiscal space, we will make the decision to support the client in their need.
And also just want to follow up, there were a number of organizations that you mentioned that handle this area. Are they relatively new, or have they been in place for quite some time? And
Believe it or not, many of these organizations are new. I know the governor recently put together an organization that is just rolling out, and the name is eluding me at the moment, but it's something we have emailed to see if we can become a part of. So there's more and more conversations around mental health, but unfortunately, it's still one of those topics that's very taboo and not very talked about. You asked the question about how do we navigate financially with certain things, and I think about one of our clients who has a $13,000 deductible. So we have to look at that person and say, they're never going to be able to get the services that they need. And so we make the decision to provide it at an affordable rate so that they can at least get the support that they're looking for because of things such as that. So most people can't afford a $13,000 deductible, and get the support services that they need.
I got a question for you.
Sure.
How do you deal? So I'm going through something with friends and family, teenage suicide. The bulliness in high school, college. How do you deal with that with families? Do you have one-on-one sessions with them, or because it seems like the colleges and the high schools don't give a shit?
You're 100% correct.
And it's really disturbing.
It is.
And
It's a good question. It's a hard question to answer, right? Because I think every family needs specific tailored care. And I think that's the most important piece as you were reading my bio and you taking that humanistic approach. And so I think in the case that you're describing, it would be a lot of conversations, both individually, right? And as a family to work through some of the things that are going on that are causing that child or that parent or whomever it is to feel isolated, alone, not taken care of, not being supported emotionally. The schools, it's surprising, truly the amount of ignoring that we do for what's going on. Bullying is one of those things that while they say there's a zero tolerance policy, I think they tolerate it more than they should. And I think it's community based also. It depends on what community you are dealing with and what Board of Ed oversees that. So I think for the first part of your question, if somebody is dealing with suicidal ideation or self-harming behavior.
I mean, someone that actually died.
And
killed themselves
it's
because
bringing
of bullying.
that family in, yep, and having those conversations and advocating. I think the advocacy is the most important piece. If we're not talking about it, it's like it doesn't exist. And so I think in many ways, if and I know it's hard for those families who have had that loss to be able to go out and advocate. But I think that's the most important piece is advocating and bringing attention and awareness to, hey, the school knew what was going on and they did nothing to support it. We've got to let people know what's going on.
Do you do any like panels or you go out and do any outreach?
Honestly, it's a dream of mine to be able to go out into the community and be able to talk to people in this format, in this capacity. We are talking about bringing a podcast to MJ out into the community. It's hard. I had a very heavy caseload. I'm not a clinician that just sits in front of folks. I do see many clients. Now that I'm in a much nicer spot, I do want to get out into the community and have conversations. And I'd be happy to talk to any of you guys independently or, within your own organizations to be able to bring more awareness to truly what's going on in our country from a mental health space.
And I work in the assisted living business, so I work with a lot of seniors, and when they come in, it takes a really big adjustment for them to get used to the community, so there is big depression going on. Not only in memory care, but even in traditional assisted living, so until they find their friends and all that. But I think that would benefit for you to ever come to the community and just talk to them.
Absolutely, I would love to, if you
That
wanna
support,
exchange numbers for sure.
absolutely. Okay, thank you.
You're welcome.
I really appreciate your holistic approach to treating mental health. I just wanted to say that, but I also was curious. I'm hearing more and more about ketamine use in mental health, and I know nothing about it. Are you a pro or con?
I think in general, I don't wanna speak too much about it, cause it's not something that I'm well versed in. I think there is an approach for everybody. There's there's TMS, there's ketamine treatments, there's, microdosing, there's all kinds of things that, sort of people are trying to dabble in and utilize. The efficacy of it, I'm not familiar with. I couldn't answer that with certainty and say, yes, that's helpful, or yes, it's not. I think any person that's willing to take the chance with themselves to get better. I think it's always it's always worth the consideration and having that conversation. I just can't speak on that particular topic because I don't have enough knowledge to be able to do so.
Thank you.
Do you find that some psychiatrists are quick to just kind of skip over the whole entire aspect of psychotherapy and just go into medication instead, and then it just becomes giving you medication after medication and, oh, this one doesn't work, let's try this one instead. And it just is a cycle that you just seem to not be able to get out of.
That's a great question, because I think in many arenas, the answer to that question is yes. And the reason why I say that is, when I think about one of the things that has supported some of the mental health crisis has been primary care doctors. And primary care doctors, I have one, I love her, she's great, but they are not well versed 100% on what those mental health conditions look like and what medications really work. They go off of sort of their top 3, top 5 medications that might work. And so to your point, yes, in some instances, yes, we are just giving a medication to treat the symptom, but we're not actually treating the symptoms that need to be treated. At MJ, so I can only speak on behalf of us, all of our providers take a collaborative approach. And so they sit with each other, they have conversations, they're seeing med intake questionnaires to see why somebody is presenting. The clinician is often the one making the referral, so they've had a conversation with that client to say, hey, these are some of the things that you were experiencing. I'm a big proponent of have that consult, have that conversation, but if you feel uncomfortable with what that APRN is prescribing, don't take it. It's all about the consultation and having another perspective on what could be impacting your mental health. We do encourage and often require that clients seek both behavioral health services and medication management, because at least we can see what's happening in-house. And then again, we have acupuncture, which can help manage anxiety and depression. So kind of to your question about ketamine, those are other ways, right, that we can treat that holistic person. But yes, there are overprescribers out there, 100%. It's easy to write a script and say, here, take this. But then when there's no follow-up and no accountability, it leaves the client sometimes feeling really left alone.
Even worse sometimes.
And even worse sometimes, 100%. Yeah, absolutely.
But they're trying to manage like the crisis.
Yes.
Yeah. But you have to have the therapy once the crisis is managed.
Yeah, and for some people, believe it or not, they'll take a medication and they want the therapy to continue. They're not ready to give it up because they recognize the connection that, listen, we all are a bunch of trauma in many ways. We look at all of our lives, we've all had trauma, big trauma, little trauma, it depends on how you look at it. And that influences how we react and how we engage in certain situations. Medication helps to sort of bring that down a little bit. It subsides it a little bit, right? But if you still have those underlying values and beliefs, no matter how much medication you're taking, you're still going to be reactive. You're still going to have anger. You're still going to have anxiety or depression. So the combination of those two pieces really allows somebody to find some balance and manage the symptoms that they're experiencing. What
area do you cover in terms of Fairfield County or?
So we are here in corporate. So we have, I would say we have, our demographic is really a lot of the Valley, Trumbull, Fairfield. We have a lot of telehealth, so we do cover other parts of
Which is great.
Connecticut.
Yep.
And we are heading down into the Fairfield area around November. So we will be servicing hopefully down that 95, 95 border from that Fairfield general area.
Can I have a question? Sure. I'm putting on the HR council hat a little bit. If an employer knows that there's an employee that's having a problem and they don't have an EAP program or whatever, how can that employer potentially encourage that staff member to go and get the assistance that they need?
That's a great question, because I think it's gonna be dependent on the comfort level of that employee being able to have that conversation and go talk to, HR, talk to their boss and say, hey, I'm really struggling. And getting that support. EAPs obviously are great and resourceful, but perhaps providing some sort of reimbursement for mental health services, or providing benefits that include mental health services, I think is really important. Many organizations do offer some sort of benefit for mental health. So I think it's more really trying to, whether it's EAP or giving some sort of reimbursement, I think that would encourage, or providing in-house services. I think depending on the organization, right, that you're running, I think in-house services could be an option.
How do corporations utilize your services or not? I mean, in terms of, that's a whole area that needs to be addressed with their employees. Have any invited you in to help with their employees or have a program in place, or?
So I particularly don't do consultation. We are getting into the school. So we have two sort of aspects to MJ. So we do a lot of restorative practices and a lot of mental health awareness in the school setting. I'm open to doing all of those things, coming in and doing consult and having conversations around how we can improve, right, within an organization, the mental health access. But we do get a lot of EAPs, so we do have people that are accessing those benefits with the organizations that they do work with. But as far as us kind of going out into the community, doing that advocacy, we haven't, but we are absolutely open to it.
How have you seen COVID affect mental health?
But we can have a whole talk about that. How have I seen COVID impact mental health? It's interesting. I don't know how many of you obviously have family friends who experience different things through COVID, but when I think about the pre-COVID world, it's very different. The people are different, personalities are different, how we handle stressors are very different. Social isolation is very different. Even with our adolescent and child populations, we're seeing a lot more, again, isolation. They're happy being in front of a screen versus connecting person to person. We see a lot of issues and simple things like interviewing process, like social skills have really been, there's a detriment to that. So because of that, you're going to see a lot of mental health disparity as well. Kids bullying, as you mentioned, was mentioned earlier, that's a huge piece, and kids are much more unkind. I think it does have to do with that social isolation, as my daughter was a COVID child around that time, so she was in preschool. And so when she entered kindergarten and we would have conversations, right, with some of the educators, they were telling us that those kids in kindergarten were so delayed developmentally because they had been COVID babies, right? They had been in that period where they were pulled out of daycares, not having that socialization. Social media has a huge impact, unfortunately. So both that COVID piece and social media does impact the mental health crisis in this country. What used to be magazines and newsprint is now access to everything on social media, TikToks, Instagram, you name it. It's influencing how children and even young adults and adults, right, are, impacted by what's going on in the world. We glamorize in many ways, self-harming behaviors, we glamorize words. So people, again, things like, gaslighting and manipulation and gray rocking, all those things are talked about in a very casual and loose way. And it's brought to the attention as it's fun or joke, or it's not taken seriously. You have things like, I don't know how many of you saw the Netflix special, Unknown Number. If you haven't, I highly encourage you to watch it. Those kinds of things are happening for real in this country, which is going to impact somebody's mental health. So I think in general, COVID has changed people, it has changed how we parent, it's changed how we're educating, so it is impacting mental health pretty drastically with anxiety and depression.
I think you're right, the social media piece plays a lot, because during COVID with the isolation, things like that, people used that as their outlet, or that as their connection, or forming relationships with people they don't even know, having conversations and with people and, you know, opinions and things of people that are maybe in different countries, who knows? You know, because they didn't have that personal connection.
Can I add to that?
Yes.
Like, I think before COVID, we all felt secure, right? And then we go through this massive illness and we're watching this death graph rise, you know, we're all glued to that daily, and you know, many people just losing their elderly parents or both of them sometimes. So I think there's definitely like a little universal trauma that we all went through.
Absolutely. I bet if we did some research truly on the human experience, right, during COVID, it is shared. When we think, I mentioned earlier about traumas, little T, big tree traumas, this is a big T trauma that impacts the entire world, the human population. And there was a lot of horrible things that happened during that period of time. And a lot of loss and a lot of not having the opportunity to process. So many people passed away without having a formal funeral or being able to attend the passing of their family members. You know, both of my parents felt very sick during COVID. We almost lost both of them and we couldn't go visit. We couldn't do all of those things. And so it's hard. It really is very hard. Social media, if I had to really put something on it as far as what has really amped our mental health crisis, I would say it's social media. COVID is just sort of a piece of that caused that trickle effect. But I think that social media has really deeply impacted our human population. Yes.
Hi, good morning. I'm Cindy Shen. I'm the dietitian at ShopRite. So I'm always thinking of things from a nutrition perspective. I think there's some research talking about mental health and nutrition, but just curious if you, you know, kind of talk about that or see that in your practice, whether there's a nutrition component.
That's a great question. So I would love to have a dietitian join our practice. Those are hashtag goals for me. But we do, so we have, right now we're running a disordered eating group. So eating and mental health are very much connected to one another. When we think about disordered eating in general, eating disorders, right? Those are anxiety-based diagnoses, right? They are means to control. Usually we see that in folks that have high levels of anxiety, some who have had significant trauma. So we do see it very regularly. We do have a couple of clinicians that are well-versed in eating disorders and really focus heavily on that. And we have, you know, like I said, I think we have maybe 10 or 12 members of our disordered eating group that are working through that. You know, it's a very hard relationship to have with food. Food is everywhere, right? We're all having our coffee today. We had maybe some donuts, right? There's a relationship to food is very connected to our overall health, our overall well-being. And when your mental health is connected to food, it can be very, very dangerous, as you guys, I'm sure know, with bulimia, anorexia, and then that disordered eating is the most hard to sort of treat because they function regularly. They don't necessarily look like they struggle with eating or, you know, disorganized eating. So I think in general, it's being aware of talking about all of those things. So we talk about it regularly, we see it regularly, but we do not have that component as another ancillary service.
Good to know. Also, I'm glad you mentioned the disordered eating because I think, you know, when I see a lot of people for consultations, it's probably one of the only times that they're getting a chance to sit down and talk to somebody for longer than 10 or 15 minutes, besides your typical doctor's visit. So it tends to be, besides nutrition, it tends to be talking about a lot of other aspects of their life. And there's so much emotional aspects tied to eating and nutrition, even if it's not, you know, that clinical disordered eating diagnosis. I always kind of see that. So I'm glad to know that you have some providers that focus on that, because I'll keep that in mind if I have anybody to, you know, refer to you.
No, I appreciate that. You know, and for me, I look at eating as intuitive, right? I'm a big proponent of intuitive eating. And when I work with clients who struggle with disordered eating, we do kind of talk a little bit about that. We have to take shame away from food, right? I think that's the hardest piece of it. But yeah, absolutely. If you have anybody that, you know, needs the support, we do have an active group right now. So it's something that, you know,
Yeah, and I know I had
give you
reached
some
out to
information.
Laura probably a year or so ago, because I had somebody who came to see me, and they themselves were like, I suspect I have an eating disorder. And I was telling them I don't specialize in that, but I want to help you find somebody. So I reached out to Laura even to see if she knew of anyone. So I'm glad that, you know, making this connection today too.
Awesome.